Medical science has been aware for a long time that exercising the muscles in our bodies strengthens and tones them. In rehabilitation, we use these same principles to repair and restore weakened or damaged muscles. We've recently adapted an exercise device that can help significantly in speech rehabilitation.
Facial Flex is a revolutionary device that helps your patients increase strength and coordination of the face and neck muscles. It's the latest refinement of a modern-day invention that can help thousands of patients as an adjunct to speech therapy. Facial Flex can help patients rehabilitate their face and neck muscles in the same way that resistance exercise can help rehabilitate other parts of the body.
Facial Flex is the new medical concept in facial rehabilitation. Facial Flex was developed by a maxillofacial prosthetist, and it's been proven to work in published clinical studies to significantly strengthen the muscles of the face and neck.
We conducted 3 independent clinical studies which clearly indicate that twice daily use of Facial Flex could increase the strength and tone of over 70% of the muscles of your face, chin, and neck.
Facial Flex is utilized for mechanical assistance in a program of regular facial exercise. It provides dynamic resistance to the circumoral muscles, and it has been shown in published clinical studies to strengthen those muscles as much as 250% when used in a daily program maintaining constant resistance. The muscles of the face are critical in articulation, forming the words we actually speak.
Facial Flex Corporation has created a product to enhance the benefits of oral motor exercise. And it's just common sense.
Speech pathologists have always used different forms of exercises to help patients strengthen these muscles, find ways to relax the muscles, and most importantly, to find ways to control the muscles so that they can be used for the fine, delicate work of making our voice and making our speech pattern.
In the area of speech pathology, we know that strength and coordination of the facial muscles is necessary for precise articulation. In the past, the only method we could use to reach these muscles was voicing vowels, e, oo, to make the muscles move and work. But now with Facial Flex, we have a product that uses resistance to target these muscles and strengthen them, and this is much more efficient. Now we're going to demonstrate 2 types of exercises. The first is for the overall strengthening of the facial and neck muscles for patients with bilateral muscle weakness. The second was developed specifically for patients with unilateral muscle weakness. Here's our standard exercise program. It should be used for patients with bilateral weakness. It's an exercise that's easily taught and followed. In a relatively short period of time, your patient will see a marked change in muscle strength and tone with a corresponding gain in function. In addition to using Facial Flex to rehab muscles weakened by surgery, stroke, or trauma, studies have been completed at Temple University School of Dentistry that revealed a significant reduction in jaw pain of patients with TMJ dysfunction. Another study of 200 school-aged children showed that Facial Flex impacts tongue strength and retraction and therefore facilitates production of the hard-to-stimulate sound. We recommend these exercises be done twice each day, morning and night in 2 sets of 30 to 40 repetitions, increasing to 100 to 120 repetitions. Each set should take 2 to 3 minutes. The level of resistance can be set at 2, 4, 6, 8, and 14 ounces by changing the replaceable elastic. Initially, the resistance should be set at 6 ounces, unless the patient is very young or has neuromotor impairments. Obviously, the final choice of time, number, and resistance is up to the individual physician or therapist. Now we'd like to demonstrate one of our exercises developed especially for patients with hemiparesis. Hold the plastic end of the Facial Flex device between the thumb and forefinger of either hand as appropriate. Insert the opposite end into the corner of the mouth on the weakened side. In this manner, using simple hand and finger pressure, the lateral movement of Facial Flex can be restricted to the side of the face and neck that's weakest. This exercise may be performed by the patient alone or with the assistance of the speech-language pathologist. With all exercise, proper form is very important for best results. This is also true when exercising with Facial Flex. So ask your patient to exercise in front of a mirror. Watching yourself helps maintain proper form during exercise. So no matter how old your patient is, their muscles respond more quickly when you use facial flex as part of the therapy regimen.
Now, to be sure you understand the whole Facial Flex program, let's answer some of the most commonly asked questions. How will you know when you've exercised long enough? Most rehab programs start with 2 sets of 20 to 30 repetitions in a 2-minute period and gradually work up to 50 or 60 repetitions per minute. But the exact amount and speed will be up to your physician or speech therapist. Doing 2 or 3 sets of exercises with fewer reps in each set may be indicated for patients with very weak muscles. How often should you exercise? Twice a day, morning and evening. The best time is after you brush your teeth. Once again, we suggest that you do 2 sets of repetitions, but check your therapy instructions. How often should you change the elastic bands? Replace them every week to keep the proper resistance. As you exercise more and become stronger, you may be asked to change to the available 8-ounce or 14-ounce elastics. If you have difficulty using the standard 6-ounce elastic that is packaged with Facial Flex, 2- and 4-ounce elastics are available. Ask your therapist for these. As far as changing the elastic band, Facial Flex has been engineered to make it very easy. Simply stretch the elastic over the 2 mounts located on the coupler. That's all there is to it. Facial Flex is ready to be used again in seconds. Is it safe? Facial Flex is completely safe. Just be sure to use it as we've shown you. If you want a clinically proven medical aid to facial muscle rehabilitation, Facial Flex is the one device that provides safe dynamic resistance training using a series of physician-developed exercises. For more information, please call us at 1-800-469-8565 or write to us at Post Office Box 99, Bluebell, Pennsylvania, 19422-0099.